In this video, I want to speak with you a little bit about the value of occupational therapy. We hear a lot about the value of OT, and we've been hearing this for a number of years now. It's been our kind of our OT community push that we should be able to speak to the value of occupational therapy and share that value and bring that value to our practices, sharing the value with other professionals, but bringing that value to our practices. And one of the reasons why I want to speak about the value of OT is because not everybody is capable of explaining it. And I think if it's something that we talk about more openly and freely amongst ourselves, we can get better at talking about it and get better at bringing our value into our practices. So I think there are a number of ways that occupational therapy practitioners bring value to treatment. Off the top of my head, I can say our occupation-based interventions, our ability to analyze activities, our understanding of the role that the environment plays, our knowledge about human interaction and dynamics among people in those interactions. And I want to break each one of those down. However, for today, I want to start with an article that came out a few years ago about how higher spending in hospitals on occupational therapy can help reduce readmission rates. So I'm going to share my screen with you and pull that article up. And there we go. Let's get rid of that. And so I want to talk about this article and what it says. This is not the full article. Let me get me out of the way there. I found on the AOTA website where they have an article about how the health policy researchers found that occupational therapy is the only spending category that reduces hospital readmissions. And they write about this information on this page. This page is accessible to anyone. You don't have to be a member of the American Occupational Therapy Association in order to access this article. If you just type in a search bar, higher spending on occupational therapy, this should show up as one of your choices. So I just want to break this article down because it's a very important article for OT practitioners because it was a study that was not done looking specifically at occupational therapy. It was independently done by health policy researchers, and it was published in the journal Medical Care Research and Review. And the results of this study found that occupational therapy is the only spending category where additional spending has a statistically significant association with lower readmission rates for the 3 health conditions that they studied in this study. They looked specifically at heart failure, pneumonia, and acute myocardial infarction. And I love what they found. It says here that the authors point out that occupational therapy places a unique and immediate focus on patients' functional and social needs, which can be important drivers of readmission if left unaddressed. This is so cool because these are things that as occupational therapy practitioners, we already know this, but it's really fun when people find out for themselves how amazing occupational therapy really is. So the researchers were from Johns Hopkins University and the University of Maryland School of Medicine. And they took a look at Medicare claims and cost data to examine the association between hospital spending for specific services and 30-day admission rates for the 3 diagnoses: heart failure, pneumonia, and acute MI. They looked at 19 distinct spending categories, and occupational therapy was included in those categories. And this was a rather robust study because they looked at 2,791 hospitals for heart failure, 2,818 hospitals for pneumonia, and 1,595 hospitals for the acute MI diagnosis. So that's a significant number of hospitals. And the researchers found that occupational therapy focuses on a vital issue related to readmission rates. And here it is, right here. Can the patient be discharged safely into her or his environment? And if not, we address the issues that are potential barriers to them being successful in their home situations. So let's take a look at the 6 particular interventions that they discovered that OT practitioners provide that could lower readmissions. Number 1, we provide recommendations and training for caregivers. We all know that we're very good at making these excellent recommendations and then training people in proper use of any equipment that we recommend, or demonstrating any compensatory strategies that we're recommending for people. Number 2, determine whether patients can safely live independently, or will they require further rehabilitation or nursing care. So again, here we are as OT practitioners with this holistic view of the person. And this is where I think the cognitive piece can come into play much more so than it already does. And again, it depends on where you're working. I mean, some places are very good at addressing the cognitive piece, but other places kind of fall behind in that category. I know at the hospital that I work in, typically they're looking at physical therapy notes to determine if somebody can be discharged or not. And I will tell you a little story that I had one day. I was sitting next to a nurse practitioner, and I was happily typing away everything that I learned about the cognition of this patient whose room I had just been in. And there were definitely some cognitive impairments there, and I had concerns and reservations about this person returning home alone. And this nurse practitioner had been in the room during the same time that I was in there, and so we were just sitting next to each other typing, and she looked at me and said, "What are you typing?" And I said, "Well, I'm typing everything that I just found in that patient's room that we were in." And she said, "You know we don't look at your notes, don't you? We never read that box." Well, I was a tiny bit shocked, I should say, maybe not completely, because I had been working for quite a long while at that hospital and had a general understanding, but for somebody to just blatantly admit to me that they don't look at that information, and she said it in such a way is like, really, you need to stop wasting your time. But I, of course, had to go on and explain to her why she should be looking at that information because of some of the things that I found, and it could impact that person's ability to be home safely. That's enough of that story. Number 3, we address existing disabilities with assistive devices so patients can safely perform activities of daily living. And some examples that they cited were using the bathroom, bathing, getting dressed, and making a meal. That's pretty basic. That's exactly what we do. And we're very good at what we do. And we're very good at pulling out if somebody comes into the hospital with an existing disability and maybe we're asking them to use a device that they haven't been using before. We're very good at quickly identifying if they're able to pick up on how to safely use that device quickly, or if they're struggling with their ability to learn how to use it. And then we make the appropriate recommendations. Number 4, we perform home safety assessments before discharge to suggest modifications. Now, I don't know how often this goes on in the acute care setting. I think at the hospital I work at, we don't really do home safety assessments before people go home, unless they're in the medical rehab unit. But I know many skilled nursing facilities are still doing home safety assessments. And this is a very important piece because we get to see how somebody actually performs in their home. And it's very nice and helpful if the caregivers are able to be there, because caregivers sometimes they're not in the loop as fully as we are in the rehab picture. And if they come in and they see their family member or the person that they're caring for on a good day, they might think everything is going to be fine when they go home. They may not see if a person is having fluctuations in their abilities. And even though we try to convey that information in our progress notes and in family meetings and team meetings, sometimes actually seeing it for yourself is a little bit more eye-opening and much more beneficial than just hearing a report. So it can open up really important conversations for how things are going to be handled at home and if they can be handled at home, and whether or not additional supports are needed. Number 5, we assess cognition and the ability to physically manipulate things like medication containers, and we provide training when necessary. So we're back to the cognition piece again. And sometimes I do think that assessing cognition can be challenging, especially if a person might have some type of a mild cognitive impairment, or it just may not come out in a typical quick acute care treatment session or evaluation session. And that's where we could probably have a whole other conversation on cognition. So I think I'm going to save that for another time. But asking a person to manipulate things like medication containers, asking people to read medication labels and report back what it says, asking people about the amount of medications that they take at home. And if we do notice a problem, then just reporting that back in our notes, reporting that to the medical team and the family members and the caregivers if they are there. Now, I do want to add in here, I think this is a nice piece that I learned about in the area where I live. I live in Western New York, and there are a number of pharmacies that provide a service, the service of going into patients' homes. They will review all of their medications, and they will remove the outdated ones. They'll check to see if there are any interactions among the medications that they're taking, because sometimes medications are provided by multiple providers. And if the person doesn't have an accurate list with them of all of their medications, or if they just try to speak from the top of their head and they forget some, or even if there is a little cognitive issue going on where they don't really understand the impact of making sure that your medications are all organized properly and being taken properly, the pharmacy can go into the patient's home and help them get that situated and straightened out. And from my experience working in the hospital and working in the critical care units, I think this is an essential service, because we have had people admitted into our ICU for accidental overdose. And it could be because of a cognitive impairment or just getting medications mixed up. And even if somebody has low vision, maybe they can't read the labels that well and they misread a label. Like, it does happen. And so this is a nice service to know about, and to reach out to the pharmacies in your neighborhood and ask them if they provide that service, and keep that information with you when you're doing your day-to-day OT. Okay. And last is number 6. We work with physical therapists to increase the intensity of inpatient rehabilitation. I have to say that one of the favorite parts of my job at the hospital is that I have always had the opportunity to work closely with the physical therapists. And it's so helpful when we get to work with patients together, especially now my role in the critical care units. We work so closely together, and we really play off of each other very nicely. We're able to help each other. We're able to help each other problem solve what's going on with the patient. And I think our patients get really good care when we are able to either co-treat with the PTs or have close communication with them, with the PT practitioners. And the other thing too is, I think when we have that close relationship with them, is they understand the value that we bring to the table. And they can also advocate for their patients to have occupational therapy services. So moving down to the end of the summary, the researchers identify occupational therapy as one spending category that affects both the clinical and social determinants of health. And they note that investing in OT has the potential to improve care quality without significantly increasing overall hospital spending. So I think this article really highlights our value. This is our distinct value. And activity analysis and the OT practice framework and our understanding of people, those are all behind the scenes aspects of what we do in all of these categories. So I hope that you enjoyed this review. I hope that you look for this article and use this article in your practice if you haven't already heard of it, or maybe if you forgot about it. This is a great time to pull it back out and really advocate for the value of occupational therapy. I'm going to stop sharing my screen now, and I hope you found value in this video. I hope I'm stirring some excitement up in you about occupational therapy. I hope that I'm reminding you of some important pieces to our profession that we bring to the table. And I hope that I'm making you think a little bit more about how we bring the value to our practices with some of those suggestions that I provided. All right, thanks for listening, watching, and have a great day.